Public Health Committee meeting to order, February 6th, it is 9:30. All members present except for Mr. McTaggart.
Mia, did you get the handouts here? You did, okay. Got one.
First item of business is we have to approve the agenda for today. Is there a motion to approve the agenda? Is there a second?
Second.
All in favor say aye.
Aye.
Opposed, same sign. Agenda is approved. Further public comments?
Did you pass something?
Roger, you have any public comments? You're the only public.
Nope.
You want stage anyway?
Oh, I'm sorry.
No agencies to report, so we'll go right to the Iroquois County Public Health Department.
Okay, what's coming around to you right now is the grants and contracts list. I just went ahead and updated it. There wasn't a lot on it. Really, the only thing is the lead grant. You can see that we finally got final signatures on it. That grant started July 1st. And it just finally got signed. We have 4 of them, 2 combined grants this year. The first one being on the front page, body art control and tanning inspection grants. Those used to be 2 separate grants, and I explained at a previous meeting that how the state has combined those this year. The application did not come out until the beginning of October. I submitted it right away. We still don't have that signed. And the same thing goes with the summer food and the child and adult care food program. Those were submitted on the same day. They came out the same day. Those were combined. So those 4 grants are now 2 grants. And the reason that we got an email actually on this yesterday. The reason that those haven't come out is because the lady who's in charge of the food, drug, and dairies, her name is Molly Lamb, with the state is still on an extended maternity leave. So she was off November, December, January, and should be coming back, they think, sometime in February. So but they keep telling us that everything's good. We know that our grant was approved. It's just not been sent to us for signature and then back to them for signature. So, and that happens a lot with a lot of our grants. Even if they aren't, what I consider finalized and signed, they still let us submit and they still pay sometimes. So, it's kind of a surprising first process, but it works. And pretty soon, hopefully, we'll have one strike for next year. Typically, in a normal year, what happens is they will send out the RFPs or the NOFOs, the Notice of Funding Opportunities, sometime, starting in March. Well, last year we didn't even get any NOFOs. The earliest we got them was at the end of May. So we didn't even write for grants that started at July 1 until June and July. And then a lot of them, as you see, didn't come out till later. I'm not sure what's going to happen with that again. That was all based on budget, the state of Illinois budget stuff, and I don't know what's going to happen with that. We might be looking at the same scenario this year. It'll all depend on the state of Illinois budget and how soon the state agencies get their appropriations for money. Because once they get their appropriations for money, then they determine how much the grants are going to be, and then we can write. So we'll see how that goes. Yep. Any questions on that grants and contracts, please? Okay. So the next thing would be the summary report of programs. So, in December last month, I said that we had issued 153 permits. In January, we issued 76. Usually those permits are issued almost always every year in December. some final ones that came in at the end of the month that didn't make our last month's end of the month count. And then if you remember, Mr. Iman was on vacation that first week in January, so even though the letters that we sent out to all of the food establishments said that they had to renew by, December 31st, we did give them an extra week without charging the late fee until he returned. That way he could look them over before we actually approved them. So that's why we have a few more in January than what normal Januaries have. Not too many wells are done in January. You can see that. So that goes down a little bit. Those always pick up in the spring and summer months and fall months. Terry did inspect the garbage waste hauler trucks. He did 12 of them in January, 14 in December and 12 in January. They did the 84 tobacco compliance inspections during the month of January. We gave out 38 radon kits, advertised that, sent out a press release. That's very important. He did a presentation on that to you not too many months ago, but radon is the second leading cause of lung cancer deaths in the nation, second only to smoking. And high radon levels are very dangerous for people. So we encourage people to come to the health department and get a radon test. The test kits are so easy to use. You just simply open them up, put the carbon filter in them, put them on the lowest living space of your house. You wait, we say an average of 5 days. You pull the filter out, you put the kit back into an envelope, the postage is already paid, you mail it off, and then you get the results.
Now, we did that for a second time because it showed some amount of time in there. But anyway, we did it for the second time, and it came back, a letter came back saying that the kit was old, back 5 years old. So we had to do it over, and Pete got it from the health department.
Well, that's not possible.
I know.
We order kits all the time.
I'll bring that.
Yeah, I'd like to see that. I've never heard of that.
So he has to do it again.
So strange.
So it was some company, it was a kit from some company that I have no idea what it's about.
And you got it from our health department?
Yeah.
Huh. I'll check on
bring it
that.
in.
Yeah. I've never heard of that.
Yeah.
We order radon kits all the time.
Right.
So, yeah, that'd be cool.
I thought I better bring it up to you.
I've never heard of that.
I've never heard of it. I've heard of an extending the expiration date on the kits, but
Never, yeah.
not 5 years.
No, that's odd. We'll figure that one out. Oh, my goodness.
Yep.
You just never know. So any questions about the environmental health part of it? Under community health, you can see that we did 63 childhood immunizations in December and 68 in January. Typically, those are our slow months. In February. February is usually a slow month too. Then they start picking up again. Reportable communicable disease investigations. I wanted to let you know that Creutzfeldt-Jacobs disease ended up being classified as not a case after the investigation because no autopsy was done and they can't confirm that without an autopsy. The hepatitis A investigation ended up being after the investigation was completed, ended up being determined as not a case. And the same with the Q fever. So, we got lucky.
Yeah.
You can see that the influenza with intensive care unit admits increased a little bit. That usually happens over the winter months. That's when the influenza is out there. That's what we're going to talk to you about a little bit about today.
I have a question.
Yeah.
What in the world is, I don't even know how to pronounce it, Histoplasmosis?
Histoplasmosis is an infection. Usually in this area, when we see histoplasmosis cases, it's from bird droppings. So a lot of times what happens is it'll be farmers that go in and clean out their cribs where there's lots of bird droppings, and once they start cleaning that, and those bird droppings kind of get in the air and they breathe it in. Histoplasmosis is a lung disease. Step in here, you know, she investigates them all the time. It's a lung disease, and those people are very sick. We have actually, at least in the years that I have done investigations for the health department, we've seen people die from
Did
it.
chickens do the same thing?
Or any birds.
Well, my mother-in-law had it, and when they first
Never heard
thought
of
she had lung cancer, so,
I have
and
now.
it looks like the same thing.
Yeah, it can be very, we've had summers where it's really bad, especially when they're cleaning out, like old corn cribs and barns, that kind of stuff.
Even your
Would
attic.
that
Yeah.
chicken farm by Lona, there's 6 million chickens in that chicken farm.
Hopefully they clean that appropriately.
It's gotta
Hopefully they
be,
have a mask.
worse where it's non-ventilated, dusty, just like your traditional farm. I've got it in both eyes.
You have had it, or once you get it, you always have it?
Hmm.
It's not, you can't get rid of it.
It's just scars in your, is it retina or there's holes in it.
Yeah. It is not a fun thing to
Did
do.
you get it through chickens?
Kids it in your,
They said I probably got it as a child.
You can get it anywhere. Yeah, you can get it anywhere in your body. But yeah, we've had people we've had cases that I investigated years ago where the people were on a ventilator for a long time. Very serious. So, yeah, we take those cases, very seriously, and then we have helped many families who had one family member who has this, but they're living on, they're using that same barn. We've helped them with how to appropriately go in and clean that barn out and how to protect themselves. Lots of preventative measures, N95 masks, gloving, talking about the appropriate cleaning measures. Yeah, so that no other family members got it or would get it. Any questions on the community health side? Notice, I will point out to you that we did have one ILI outbreak, that's an influenza-like outbreak, that was determined influenza, and that was in a long-term care facility. And then we also had a norovirus outbreak in a long-term care facility. So those investigations, for example, with the norovirus investigation, what we do is we have the long-term care facility compile a log. They have to keep an illness log that's very detailed, on all their clients, so that we can...
Residents and staff.
Yes, residents and staff. So that we can determine when the onset was, and we can look to see what our incubation periods are, what the duration is, what the transmittal time frame is, and then once they go, how long is it?
96 hours.
96 hours with no further illnesses, then we can start to close the case. But in all those cases, we collect, usually it's around 5 stool specimens in a norovirus case, and we ship those from the health department to, we have them collected at the long-term care facility. We send those into the state lab, and then those are tested positive. But I've used this example a lot. Norovirus is like fishing for trout. You can even look down in a trout stream sometimes and see trout going by. But every time you stick your hand down, you're not going to come up with a fish, okay? Same thing with those norovirus specimens. That's why we collect 5. If we get 1 back, we know that that's what it is, 1 back positive. So that's kind of how that works. Then we know what kind of an illness we're looking at, especially if they all have similar signs and symptoms. We had a school call us in Iroquois County that was reporting an increased number of student absences. So after we explained to them that what we're looking for are children with similar signs and symptoms, because they had a very high percentage of their student body that was absent. But when you find out that, you know, let's say 30 some kids are absent, that 3 of them are on vacation, 2 of them, one was having surgery, you know, 2 of them had regular doctor's appointments that were scheduled for an ongoing issue. One of them had a completely different illness. You know, some of them had upper respiratory, some of them had, you know, vomiting and diarrhea. Then we looked at it, and overall the percentage wasn't high enough for one set of diseases to do that. But that's what we do. That's part of our investigative process, is making sure that we know what's going on in the community, and then we provide that school with, you know, a lot of measures to prevent the spread of diseases. A lot of education, a lot of recommendations. Sometimes, if they need it, we'll draft a letter for them to send home to notify parents of what's going on and what signs and symptoms to watch for in their kids. We remind people, you know, to cover their nose and mouth when they cough, and that they need to be fever-free for 24 hours without the use of fever-reducing medicine before they can come back to school. You know, all that kind of stuff. Doing those investigations is a reasonable amount of work for someone who hasn't never done that. But we enjoy it. We like doing that. We like the education part, you know, so forth. So, any questions about this? Okay.
I do.
Yeah.
I'd like to back up a little bit to environmental health.
Okay.
And Ray Dodd,
Yeah.
your office gave me a kit,
Yeah.
and I just got some information back just a couple weeks ago. And the information was that there was some radon. It went from 0.06 to, I'm not sure about this other number, but I think it was like 1.6.
Okay.
There's nothing to be concerned about at this time,
Right.
but then check it down the road.
Mm-hmm.
Does that sound?
Yeah. Yeah. Keep checking.
It's pretty low, but there is some measurement.
It's not uncommon to find some, you know, in households. Iroquois County does sit on, if you look at us, compare us, there have been graphs where in the past, I haven't seen one recently, but where they compared Iroquois County to other counties in the state and other states in the nation. And Iroquois County does obviously sit on some uranium deposits. You know, there's uranium in our soil. So as that breaks down, it creates radon gas. And that gas then is odorless, and it's tasteless, and it's colorless, and it seeps up through the ground. And if your home sits on one of those areas where there is a lot of leaking, it can cause lung cancer. So you really want to make sure that you know whether your home sits on that or not. Because if it does, there are things you can do to mitigate that and get rid of that gas.
Like
You know,
what?
well, a lot of times they'll put a fan and an exhaust so that it takes the gas up and out of your house. Terry works with people on the mitigation of that, so he's a lot better explaining that than I am. But there are definite measures that you can take and then retest your home, and then those levels drop. So that's why we so encourage people to know, because there's something you can do about it.
Would you think it would be a good idea for me to make my neighbors aware of what we discovered?
It's not a bad idea. Everybody should be testing their homes. Really, everybody should.
That's why I get that.
Yeah. We can. You know, since you come to the county a lot, if they, you know, you live a little bit of a distance, I could give you papers. You can have them fill out the paperwork, and then you can bring it back. I could give you the kit for them. You know, yeah.
I would be glad to do that.
Yeah, we think everybody
One of
should
my
do
neighbors
this.
is in Florida right now, but the other one is home.
Yeah, but we highly recommend that everyone test their home.
Huh.
It's important. It really is.
Has anyone at the table besides me ever tested for radon? Have you?
You got some.
Yeah.
Yeah, I have to do it a second time.
Did you had to do it twice? Really?
Because I have a level evidently.
Okay. That's interesting.
Yeah,
We'll definitely retest you.
yeah.
Any other questions?
Thank you.
You're welcome. So, just for a few minutes, Donna and I thought we'd talk to you about flu. You know, I told you last time I would let you know how they determine what's in a flu vaccine, so I'll do that. But before we do that, since this is videotaped and the public does watch this on YouTube, we thought we'd use this as an opportunity to send a little education out there too. So, the flu is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. We preach this constantly as healthcare professionals. There's no such thing as a stomach flu. You know, our grandmas called vomiting and diarrhea the flu. That's gastroenteritis and is usually caused by something called norovirus or something similar to norovirus. But if you have a true flu, it's upper respiratory, okay? So the signs and symptoms of that would be fever, cough, sore throat, running or stuffy nose, muscle or body aches, headaches, fatigue, and some people can have vomiting and diarrhea with the flu if they're swallowing a lot of mucus. That makes them do that. But typically, vomiting and diarrhea, you don't see that in adults with the flu. Most experts believe that the flu spreads mainly by tiny droplets that are made when people cough, sneeze, or talk. And those droplets travel up to 6 feet in diameter. So every time you sneeze, anyone within 6 feet of you can breathe that in.
6 feet.
Up to 6 feet away. Less often, a person might also get the flu by touching a surface or an object that has the flu virus on it and then touching their own nose, mouth, or even possibly their eyes. Periods of contagiousness, usually people may be able to pass on the flu to someone else even before that they know that they're sick. Although people with the flu are most contagious in the first 3 to 4 days after their illness begins, some otherwise healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after they become sick. Some people, especially young children or people with weakened immune systems, might be able to infect others with the flu virus for an even longer period of time. The onset of symptoms, so the time from when a person is exposed to the flu to the time when symptoms begin is usually about 1 to 4 days, with an average of about 2 days. Complications of flu can include bacterial pneumonias. A lot of people, even though the flu is a virus, they'll get a bacterial, because their immune system is weak, they'll get a secondary bacterial infection with it. So bacterial pneumonia happens with people a lot of times. Ear infections, sinus infections, and then worsening of chronic medical conditions like congestive heart failure or asthma, those types of things. People at higher risk from the flu are usually people who are age 65 or older, people of any age with chronic medical conditions, like I said, heart disease, asthma, diabetes, pregnant women, and young children. And those are your most susceptible people. The first and most important step in preventing the flu is to get a flu vaccination each year. The CDC also recommends everyday preventions like staying away from people who are sick, covering your coughs and sneezes, and frequent hand washing to help slow the spread of germs that cause respiratory illnesses. The flu is diagnosed usually through a nasal swab, and the doctors then will send those in for testing, and then the person will either test positive or negative. There are 4 types of influenza viruses that we are very concerned about at the health department, and those are types A, B, C, and D. Human influenza A and B viruses cause seasonal epidemics that usually occur during the winter months. But influenza type C is usually a mild respiratory illness and are not thought to cause epidemics. And influenza D viruses primarily affect cattle and are not known to infect or cause illness in humans. Influenza A viruses are divided into subtypes. So when you hear about viruses going around, you hear it on the TV a lot. Like, for example, you heard H1N1. Okay. Influenza A viruses are divided into subtypes based on two proteins that are on the surface of the virus. And that's the H protein and the N protein. And there are 18 different subtypes of those, and 11 of H, and 11 subtypes of the N. So you can have H1 through H18, and you can have N1 through N11, respectively. Right now, this season, we are still seeing H1N1, but the primary one that we're seeing is H3N2. And I'll tell you about that in a little bit. Influenza B viruses are divided into subtypes that are broken down to lineages. So the two most common are the B. Yamagata and the B. Victoria lineages. The CDC follows an internationally accepted naming of influenza viruses. So you know how hurricanes are named, right? So are viruses, and there's a process to that. That is accepted by the WHO, the World Health Organization, and I have an article if you want to read on how they name them. It's pretty interesting, but I won't go into that. That's pretty in depth. But when they name them, somebody in the medical field can tell what type it is, whether it's A, B, or C. We can tell the host of the origin, whether it came from swine, equine, children. If it's a human, if it comes from human, if it's only spread from human to human, then they don't name that part. They leave that part out. So we know it's a human origin. And then it also will have the geographical origin, like it'll say Denver or Taiwan or wherever. It'll give a strain number, the year of isolation.
When you say strain, what is a strain?
A strain number, remember those 1 through H1 through 18 or N1 through N11?
So
Those are strains. Mm-hmm. And then it'll give the year of isolation. And then sometimes it'll give you a little more detail in there, but we can look at those and tell a lot about that virus. So, for example, if you get one that says A/Duck Alberta, you know that it was a virus that came from a duck origin and that it started up in Canada. Influenza A, H1N1 and H3N2, and 1 or 2 influenza B viruses that are included in each year's are included in each year's influenza vaccines. Getting a flu vaccine can protect against flu viruses that are the same or that are related to the virus in the vaccine. So even if you don't, most flu vaccines are either trivalent or quadrivalent. So they either have 3 or 4 strains in them. The ones we give at our health department are quadrivalent. So we give a non-live virus vaccine, meaning that the vaccine doesn't have any kind of live virus in it. It's a killed protein, so no one can get the flu from the vaccine. That is impossible, physically impossible. Okay, you cannot get the flu from a flu vaccine. If you get the flu right after you got a flu vaccine, you were probably exposed to that virus, before you got your vaccine. And then the ones that we give, like I said, are quadrivalent. So they have 4 strains of them in it. So ours typically have 2 A strains and 2 B strains in them. Even if the strains that are in that particular vaccine aren't the exact strains that are running through a community, you will get some protection from it because they all have similarities in the strains. So you may still get the flu, but you may get a more mild case than you would have gotten if you had not gotten the flu vaccine. But there are a lot of non-flu viruses that can result in an influenza-like illness. For example, the rhinovirus, which is the common cold. There are cases where a bad common cold mimics some of the flu symptoms. And then RSV, the respiratory syncytial virus, that is the most common cause of severe respiratory illness in young children. A lot of children get RSV. So it's important to know what's going around the community and to test for it. I have an article here that I won't read you everything. It says, how health officials determine the viruses used in the flu vaccine. And it says, how do researchers know which flu strain will be the one to cause the most damage each year? According to the CDC, researchers are constantly on the lookout for indications that there are different viruses circulating than there are in the influenza vaccine. In order to understand if any new or more dangerous strains are in circulation, CDC officials have to work with numerous countries across the globe. They receive viruses from all over the world. They test those viruses to see if they are similar or different, and compare it to what's already in the vaccine. It says if we do see a new variant virus, we look at the spread of that virus within China or other countries. If we see that pattern, we take the virus and we test it against the serum from people who have been vaccinated to see if they have antibodies against that new virus. A group of experts, including CDC experts, most of them are from the World Health Organization, work under the umbrella of the World Health Organization. So we participate twice a year in a consultation that makes recommendations for what components will be in vaccines for both the Northern Hemisphere and the Southern Hemisphere. They have a lot of data that they gather and analyze and present that at the meeting. So this year's current nationwide influenza epidemic, and they are now calling it a pandemic. An epidemic is a smaller region, a pandemic is the continent. The current flu, the current thing that we're seeing, like I said before, is H1N1 and H3N2. H3N2 is a seasonal influenza virus, and then it also includes 1B if you're just doing the trivalent. But it talks about, and I won't read all this to you, how they get to determine this, and they look at in years and years ago. I was going to bring you the history of it because that's really I always find that interesting. They used to, when they didn't have all the ability to test all these viruses and to DNA these viruses for their strains, they used to watch the migratory bird patterns, and flus tended to follow those patterns. It was pretty interesting. There will never be a vaccine. A vaccine will never have 100% guarantee that somebody's not going to get sick. That's never going to happen. Each year, even in years where there's been a good match, and by the way, this year is not a good match. Okay, we all know that, right? There's not a good match this year. But even with a good match year, some people still don't mount good antibody responses to the vaccines. So even if the vaccine components match what's circulating, you'll have vaccine breakthroughs. No matter what, there's absolutely no way to be certain about which flu strains will circulate or if completely new strains will emerge. And I'm going to give you an example of this. Remember back in 2009 when we had H1N1 that was circulating through multiple continents, okay? If you remember, one of the things that we told people was we need to vaccinate the children and the elderly. But the people who are healthy and don't have other chronic health conditions, who are not over the age of 65 or not considered someone who's pediatric, 12 or under, really it didn't affect those people. Well, the reason was because these strains circulate through society over time. The 1918 Spanish flu that wiped out a bunch of people was actually H1N1. So over time, there are ebbs and flows, and these viruses come and go. But you have to remember the term survival of the fittest and how things in your environment mutate and change. So even if someone was exposed as a child, so I'm 51 years old, okay? So I was exposed to H3N2 as a child, I'm sure, because there was a big outbreak in the late 1960s and early 1970s of this H3N2 that's circulating right now. So I'm sure as a child I was probably exposed to that. So I have some leftover immunity in my system. Whereas my daughter, who's only 16, has probably never, been exposed to that. So if she gets it, she's going to get a lot sicker than I am because I've still got some remaining antibodies in my system. So flu vaccines are never going to be one size fit all for anybody because it depends on what you've been exposed to, in your past. Depends on how sick you were, how high of an antibody level you obtained in your own body. Let me give you another example of that. Chickenpox. We don't see chickenpox anymore because there's a vaccine for it. Kids don't get chickenpox, but everybody sitting at this table is probably old enough. We probably all had chickenpox as a child. Maybe not, Amanda. But the rest of us probably had chickenpox as a child. My son got chickenpox around 1998, 1999, somewhere in there, but he didn't run a fever with it. So, just out of curiosity, because he broke out, and I recognized that he had been exposed, so we were watching for it. Sure enough, he got chickenpox, but he never ran a fever. So, later on, I took him, I waited about a year, and I took him and had a blood titer done, just so I would know. Is he immune to chickenpox, or should I get him a vaccine? His immunity was not high enough, and so I had to get him a vaccine. So he got chickenpox, I had chickenpox, but I built up immunity, he didn't. It just depends, everybody's body's different. So when somebody gets the flu, that's why somebody in the family can get it and have it so severely, and somebody else can get it and have a mild case. It depends usually on their history, the history of exposure. But if anybody wants to read these, I'll sure share them. They're kind of interesting reads. Troy likes that kind of stuff. So here is the actual influenza report from the CDC. I'll pass that around. That came out, influenza season week 4 ending January 27th. Now, I will tell you this much. Typically, in a typical season, you're going to see anywhere from 10 to 20 weeks of influenza. We just ended week 6. So we know we're probably about halfway through. Okay? Let me give you some updates. We have conference calls on this on Fridays during influenza week. I have the transcripts. I printed out the transcripts from the last 2 of them, but I wanted to point out a few things for me. I'll do the most recent one, which is from Friday, February 2nd. So as of this week, meaning last week, overall hospitalizations are now the highest we've seen, even higher than the 2014-15, which was our previous high season. So they're predicting, a bad season this year, which we know is true. This week, they reported an additional 16 flu-related pediatric deaths for this season, which meant that there were even more families now devastated by the flu. And that meant that they had received reports for a total of 53 children who had died from the flu so far this season. Okay, so in 6 weeks, you had 53 children nationwide die.
And why is that? What is causing them to die?
Usually they become so infected that their respiratory system gets out. They end up with a pneumonia, and probably a secondary bacterial infection with that, and die from pneumonia. That's usually what happens. It says that the speaker said, I also know that there are ongoing concerns about whether the flu vaccine that many people received will be effective or whether you'll be able to fill a prescription for antiviral medicine. While we still don't have all the answers, here's what I can tell you. We continue to recommend the flu vaccine even though we know most flu vaccines have low effectiveness against the H3N2 viruses. effectiveness against other flu viruses is better, and there is more than one flu virus circulating this season. We know that H1N1 and H3N2 are both circulating this season. It says the vaccine may also reduce the severity of symptoms if you catch the flu in spite of being vaccinated, and it's not too late to get a vaccine. That as of January 12th, more than 152 million doses of flu vaccine have been shipped nationwide. And it goes on to give other details like that. But I highlighted a few things that I wanted to tell you. So for this week, influenza-like illness has increased again, and last week the number of people, even in the clinic, that had influenza-like illnesses was 6.6%. So what they mean by that when they give you those, when you hear that stuff on the radio, because I actually heard that on the radio. It says this week it hit 7.1%. We've had 2 seasons in the last 15 years that were higher than that. The first was in 2009 with the H1N1 pandemic, which peaked at 7.8%. And then the 2003-04 season, which was a high severity of H3N2, which peaked at 7.6. Now already we're only halfway through it and we're at 7.1. What they mean is that 7.1% of the people who are going into the emergency rooms are going in and testing positive for influenza. So they're actually predicting that by the time we're only halfway through our season, we might not even be halfway through our season if we have a 20-week season. They're predicting that we're going to see more influenza illnesses this year than they have in the past 15 years. The average, like I said, the average duration of the flu season over the last 5 seasons has been 16 weeks. But it's always a range from, this says 11 to 20 weeks. I was always told 10 to 20. So they're predicting that flu hospitalizations in the United States will well exceed the 710,000 that was seen in 2014 and 15. They know that most of the people who are the highest rates are, again, overwhelmingly in people aged 65 years and older. People that are 50 to 64 years of age have the next highest rates, followed by then the children who are younger than 5 years. So there's just a lot of information about why they think it's so bad this year. They know that H3N2 has a variant strain. They've seen a variation in it. They've compared the antibodies against people who have the flu, against people who have had H3N2 in the past, and they're seeing a completely different DNA. So, I mean, not completely different, it's still the same strain, but so that they can identify the strain, but they're seeing mutations. They call that a genetic drift. So, when you hear the term genetic drift, you know that viruses are changing. So that's always a scary thing. One of the problems that they found this year is, it says, so it is a problem with this H3N2 that we're seeing right now, especially that when you take these viruses and try to get them to grow in eggs, they make changes that make it very difficult for them to stay looking similar to what is actually out there circulating. So that's always not a good sign. But they are predicting that we are going to see a longer than 16-week flu season. They're predicting we're going to be closer to the 20 weeks this year, and they're predicting more hospitalizations and more deaths. So that's pretty scary.
Yeah, we got anything to add in the corner?
I do a lot of talking. But interesting readings. If you want to read these, I can make copies for you, or I can give them to you because I can print out my other ones.
I have a question. Is there any truth to this whenever someone will say, well, everybody's sick because it's too warm, the bugs aren't killed yet?
No.
I don't
No.
know what to tell.
That's a wives' tale. That's a wives'
We
tale.
heard a lot.
Yeah, you do.
I know.
It's not cold enough.
It's really, that's not true, because human bodies, whether you're outside or inside, your body temperature is probably going to be 98.6 or around there. at all times. So that's just kind of an old wives' tale. There are lots of wives' tales out there. You know, like I said, especially with the difference between people call it the stomach flu. Well, there's really no such thing.
Throw a few coincidences and then people think it's true.
Yeah. So,
That was very interesting.
Yeah. but hope, and if you guys are interested in following this, just jump on the CDC website, it's cdc.gov, and they'll give you this weekly update. You can actually read the transcript from the meeting, from the meeting that they have with all of us. They have a conference call with us every week. And you can read the transcript from it and read the questions and the answers and everything. It's kind of interesting. So when you go to the CDC website, up at the top, it'll have different topics. You'll click on the one that says communicable diseases. Click on that one. And then underneath it, it'll give you a list of diseases. Click on flu.
Okay.
And it'll tell you what's going on. What do you guys want to hear about next month? How about next
There's a
month?
lot.
Terry Iman has made a request. He would like to bring something to you about his food and restaurant inspections. He wants to show you, he just developed a really neat, his own graph where he's tracking Iroquois County food establishments and what those violations are, if they have violations, and what he's seeing the most of. How about if I have him bring that? Because he asked if he could bring that sometime. How about if I have him bring that next month and you can see what are most common violations? Yeah, he tracks it.
Yeah, I'd love to see that.
Yeah,
Sure, that'd be great.
yeah. So how about I have him do that?
Yeah,
That'd be good.
sometime in the food service.
Any other questions for Dee?
Thank you, Dave.
Thanks.
Good
Thank you.
job.
Is there any old business to come before the committee? Any new business? Hearing none, I would entertain a motion to adjourn.
So moved.
It's been moved, is there a second? Seconded by Mr. Kokenauer. All in favor to adjourn, say aye.
Aye.
Opposed, same sign. Meeting adjourned.